ways it started was I didn't know how I could tell my wife, hey, I want to join the Navy. And I remember I'd gone on a mission trip to Africa, and when I got back, this was years before, I said, hey, my wife said, I'm very proud of you, but I just want to let you know if the Lord is ever calling you to Africa, he's not calling me. So we're driving down the road one day, and we see a flag on a coffin, on a hearse, and she goes, that is so cool. And I was like, well, maybe there's a chance, not that I want that soon, but that she finds service would be something. So I said, I got to talk to you about something really important later. And it turns out that's a bad setup, because she automatically thinks like, do you have cancer? Or are we getting divorced or something? Not at all. And so later on that night, she's like, what is it? And I realized, I said, I really feel like God's calling us to Africa. And she was like, no. I said, I'm just kidding. I want to join the Navy. She's like, go for it.
Oh, that's exciting.
Because I'd gotten a letter that said, we need orthopedic surgeons badly.
Oh, okay.
And so she said, yeah, go for it. And without her support, obviously, I wouldn't have done it.
Exactly.
But it was such a, one of the things I'm, hopefully not anytime soon, but I think having a flag on my coffin is going to be like, what a great way to go out. Welcome to Under the Knife, the podcast where we cut into topics such as politics, life advice, and medicine, and we do this with the precision of a licensed orthopedic surgeon. I'm your host, Dr. Craig Green, an orthopedic surgeon and elected public official. Well, Shetila Burrell, welcome to Under the Knife with Dr. Craig Green. Thanks for joining us.
Well, thank you for having me. It's a pleasure.
Now, how would you like to be addressed today? Because when we were in the Navy, we were in the Navy together. That's why I wore my Navy T-shirt. But you were my boss. You were one of my 4 bosses. So we'll get into that in a little bit. Did you finish as commander, lieutenant commander?
I'm still in. I'll be up for commander soon.
Okay.
So
yeah,
I'm trying to weigh the waters till I get there.
Right. That should be upcoming.
Yes.
And then, is your title now nurse practitioner?
Yes, it's just nurse practitioner.
Okay.
Family nurse practitioner. Yeah.
Well, and so you wear many hats.
I do.
Yeah.
That's honest to God truth. I do wear many hats.
When did that start in your life, wearing so many hats?
So I guess when I got off of active duty.
How long were you active duty?
8 years. 8 years active duty. I was on several different ships, lived on them, traveled with them. They were my home for about about 4 years.
Let's back up. How did you decide to join the Navy in the first place?
Crazy story. You know that the recruiters come to the high school, right? So I seen this gentleman in this white, clean uniform. I was like, oh, this is so nice. I love that uniform. And I was in ROTC, Army ROTC. But the attraction to the uniform is what pulled me into the Navy.
Uniforms matter.
It does.
Yeah.
It does.
So that was in high school?
Yes, Terra High.
Terra High, okay. Yeah. I want to ask you what year. I'm a gentleman. You're way younger than me, so that's okay. So you went to college and you decided, I'm going to be in the military then? No,
that's not how my pathway went. Exactly. My mom has actually signed for me to go into the military because I was in the delayed entry program. It was a program they had many years ago where you can sign up at age 17.
Wow.
And your parent can give permission for you to join right out of high school. So a month after I graduated high school, I went to boot camp.
Wow.
Yeah.
So at that point, nursing wasn't in the picture?
It wasn't at all. My hopes and dreams were to become an attorney.
Okay.
That was my focus. But what led me to the medical field was I got a call. I was not overseas. I was stationed in Guam on a ship, and I got a...
So what was your job in the Navy at first, if it wasn't medical?
My first job was a ship serviceman. It was supply.
Okay.
So I made sure I was on a subtender. We took care of submarines. Made sure they were fully stocked and they had everything they needed. So we traveled to Japan.
And you're how old at this point?
At that time, I was 17, 18.
And you're on a ship traveling to Japan?
Exactly. Yep, it was fun,
remarkable.
Exciting.
Yeah. So you were taking me from supply to nursing.
Exactly. Right? So I received an AMCARS message on the ship stating that something had happened to an immediate family member. So when that happens, they fly you home like the next flight was ever available. And it was my brother. My oldest brother had, he was working in a barbershop. He was a barber. He was attending ULL, but he would come home and work in the barbershop locally in Baker. Someone started shooting in the barbershop, and one of the bullets hit him.
No.
Yes. He was in Lane, I don't know if I should say the hospital, but he was in our local hospital here. And I had 5 days here, and that's all they gave me. He was in ICU. I got to see him alive.
Was he older or younger?
He's older. He's like 3 years older than me. Got to see him alive. He spoke to me, said, hey, his body was very, very swollen. Apparently, he must have got hit in one of the kidneys or something, and they wasn't not pulling the fluid off him like they were supposed to. In the process, he ended up passing while I was here. So I was able to attend his funeral, and I just felt in my soul that something else could have helped him live a little bit longer, and he shouldn't have passed away. So that was the
catalyst.
Yes, that changed the trajectory of my career.
Do you ever think about how, and this is a theme I think throughout most people's life, mine is included, tragedy can lead to opportunity?
Yes, I do.
Via perspective, change of course, etc., and often with a catalyst, right?
Mm-hmm.
I mean, what a terrible scenario.
It is.
But you have a career that you can look back and say, this changed it.
And it definitely did that. It definitely did that. And it.
So you had to get back on the ship. So then how do you go from supply to nursing?
So happily, the Navy wanted to downsize like 4 years after that, my 8-year mark. And I was up for higher tenure. I was still E4 at the time. And they gave me the opportunity to get out. I had was a single parent at the time. And I was like, and I tried to go to school while I was in the Navy at night, but it was very difficult because, when the ship says you have to go, you have to go.
Right.
So I was
online school wasn't a big deal then.
It wasn't, and they wasn't like motivating you to further your career, basically, in opportunity-wise for advancement. So I was like, okay, I'll do this, I'll finish. And then they gave me the opportunity to get out and get some, pay me to get out. I was like, I'll take this opportunity and I can go in the reserves. So I signed up to get out, signed up for the reserves, 8/31 of 2004. I was deactivated from active duty. 9/1 of 2004, I was activated into the reserves.
Okay.
So.
And is that when you were about to start nursing school? Or?
Exactly.
Okay.
So before I actually got discharged, I had looked into schools, and several schools here I looked into to see what would benefit me as a single parent. And knowing that I had family here and stuff that would help, but, I really didn't count on anybody because I was just that person.
Right.
So looked into the schools, see what was more beneficial for me, and then weighing my options on a bachelor degrees versus an associate's degree. When can I start working sooner? So I narrowed it down to 2 local schools here, and then I weighed my options on the degree level. What's the most promising for me to move forward? Okay, so I ended up going to one of the local universities here, which is Southern University. Received my BSN in 2009 and pursued nursing there. I started out at Earl K. Long.
Wow.
And I was a tech there. And when I was in school, I was teching there. I was in the ICU there. You see many, many things at Earl K. Long.
A lot.
And I'm never going to forget this one patient. This young man, he had 10 GSW wounds. And I used to always question myself. I say, why did my brother survive and he survived? So there was always a question in my head on the care that was presented.
Could it be better?
Exactly.
Yeah.
So after I graduated, I worked there for several months, and then working with the residents
Yeah. We might have crossed paths there a little bit.
and everything. I worked on 2 South,
Okay.
So it was a med-surg floor that serviced incarcerated members. Also, it serviced same-day patients and some things of that sort. It was a mixture of everything on that floor. So, and then I started to notice, I was like, we advocate as nurses at the bedside, but what can we do more? At the time, I didn't know there was a program to advance your degree as a nurse practitioner, because I was only focused on being a nurse.
Right.
And then I started hearing about things, I started researching things, and my mindset was like, how can I advocate or take care of these patients a little bit better than what they're receiving?
Be the provider.
Exactly. So that's what prompted me to go get my degree as an NP.
So at this whole time, you're in the reserves, though.
I am.
Okay.
I am.
So you eventually go from E3 to what's soon going to be 05.
Never thought I'd be an officer. Never when I first joined, I was just like, I'm going to make it to E6 and I'm going to get out.
Yeah. But to go from enlisted 3 to soon to be 05, that's quite a journey.
Yes, sir, it is. It is. It's an amazing, adventurous journey.
You have multiple adventures.
I have.
So now, how long were you a nurse before you decided I want to be a nurse practitioner? And then how long did it take you to become a nurse practitioner?
So I had been a nurse for, you get a lot of experience at LSU, so you on top of everything, you know how to put things together to make it work. So I had been a nurse for 2 years because I started NP school in 2011. Okay. And graduated in 2013, yes.
And I think we met in 2016.
Yes.
And
I was already an NP.
Right.
And I was one of the first groups that they allowed you to convert from a nurse to NP in the Navy.
Huh.
Yeah.
The Navy was okay with it?
It was. They were. Because they really didn't have a standard type operational procedure, SOP on it at that time when I first came, which was kind of good because it's kind of hard to do it now.
Right.
Yeah, and it made it easy for me.
Well, I know when I first got to the Navy, I came in as an 04 because they credit everything that I'd done from college basically to get into the Navy as years of service. And it wasn't bad for them either because they had a fully trained orthopedic surgeon that they didn't have to pay anything for. Exactly. So it's called lateral entry. But the funny thing was I would get there, and then it was the E3s and the chiefs that were like, you have no idea what you're doing. Because the Navy is all protocol.
Exactly.
Where to put your feet and how to, walk, make your bed, all that. And so I felt like I outranked most people, but I had no idea about the protocol. And they knew that, and so I would ask you and other people. Y'all always so kind to me of like, no. Face this way or face that way. What were y'all's thoughts? I mean, because doctors don't often join.
They don't, but they do it because of service.
Yes.
And we do greatly appreciate that, and I know the Navy does, because it's hard to get physicians to come on board because it's like you're taking away from your civilian life to support the country.
That's right.
And you have to be dedicated and honored to do that because you're leaving a lot on the table when you come from civilian to military.
It's sacrifice.
Yes.
And I viewed it as that, but also loved the people that when our drill weekends and our service time together. I feel like we all got pretty close.
We embraced each other, and that's what we do.
And I remember when I was at officer school, one of the things they said is, and I've always remembered this, they said, you're the top 1%. The voluntary military, much less the officers, you're in the top 1%. And you're held to a voluntary, unfair, higher standard. Meaning, wherever you go, whatever you do, there's a higher standard, and it's unfair. And you're volunteering for it, so you can't complain about it.
Exactly.
And I think about that, and they also said, look, once you're a naval officer, you're always going to represent the Navy and the officers in the Navy. And so your behavior has to be accountable to a higher level, and it's voluntary and it's unfair. And I don't know if you remember hearing that or anything, but that always stuck out to me.
It is true. It's true, because you always got to remember, even if you're not in an active status, that
Right.
you represented the country. At the end of the day, you represented the president, the chief of naval operations, the CNO, all those great people that's above us, because you have been a part of that great revolution of sacrificing for the
Right.
country.
Right.
And however you present yourself to the world, you always have that on your list.
And I never forget, I mean, one of the ways it started was I didn't know how I could tell my wife, hey, I want to join the Navy. And I remember I'd gone on a mission trip to Africa, and when I got back, this was years before, I said, hey, my wife said, I'm very proud of you, but I just want to let you know, if the Lord is ever calling you to Africa, he's not calling me. So we're driving down the road one day, and we see a flag on a coffin, on a hearse, and she goes, that is so cool. And I was like, well, maybe there's a chance, not that I want that soon, but that she finds service would be something. So I said, I got to talk to you about something really important later. And it turns out that's a bad setup, because she automatically thinks like, do you have cancer? Or are we getting divorced or something? Not at all. And so later on that night, she's like, what is it? And I realized, I said, I really feel like God's calling us to Africa. And she was like, no. I said, I'm just kidding. I want to join the Navy. She's like, go for it.
Oh, that's exciting.
Because I'd gotten a letter that said, we need orthopedic surgeons badly.
Oh, okay.
And so she said, yeah, go for it. And without her support, obviously, I wouldn't have done it.
Exactly.
But it was such a, one of the things I'm, hopefully not anytime soon, but I think having a flag on my coffin is going to be like, what a great way to go out.
It is. It shows you sacrifice for your country
Right.
and your people. You sacrifice your family sacrifice for you, and you show commitment.
Yeah.
That's a big honor.
Right.
I did a couple of funeral details. People really appreciate the sacrifices that we have done for their lives to be safe here in our country.
Yeah, that's one thing. And if we had to do our country a do-over from the beginning, I think a lot about what would it be different if we had mandatory conscription, where you come out of high school, you have to serve for 2 years, and then you start your life. And I think that we'd have maybe different problems, but there would be a perspective about protecting what we have.
Yeah, and the trajectory of many, many, many young people's lives will be different.
Right.
We wouldn't have so many, I don't want to say violent type people, structured type people. It would be more structured environment.
I think it's impossible to be, or to stay in the military and be undisciplined.
You got that. That's so true.
and discipline is something that, most disciplined people aren't disciplined in one area of their life. It's a theme in every area.
Exactly.
In their relationships, in their finances, in their, promptness. You show up late at the Navy and there's consequences, right?
Yeah. You feel like you did a big, boo-boo. I kind of did it today. I was like, oh, my God.
No.
And you get your anxiety level gets up. It's like, oh, no.
Yeah.
Yeah.
Well, so you're still in. What was it like during COVID? How would you do drill?
We did virtual drills. So we did that for several months. It was quite interesting doing PT.
Yeah.
Physical training, I should say, virtually. But it was kind of a good part of it as well, because you got to stay at home with your family. You didn't have to go like 2 hours away, because, we drilled in Bell Chase locally here. But it was, it was different. It was very different.
Right.
Everything had to be computer-based.
Right.
Yeah.
Let's switch gears and tell us a little bit about your journey, nurse to nurse practitioner. So 2011 you finished, or
2013, I finished nurse practitioner school from Southern. I graduated there 2 times over. So after I finished...
Because as a nurse, you're doing what
bedside.
The doctor says.
Exactly.
But now you're having to think as you're the provider.
Exactly, which is a different whole perspective on how you analyze things.
Right.
Critically think as
Problem
well.
solve.
Problem solving. So it's like, okay, I'm going to be in charge of someone's life. I'm making decisions and stuff like that for someone's life. So I was always reading because I'm just so like skeptical about telling somebody something. I say, well, let me go and look this up and let me make sure, let me consult with this doctor and things like that, because we still consult with our providers and stuff like that to make sure this is the right move we need to make. But you put more into wanting to find out what's the problem versus just trying to push someone off.
Right.
And that's my attitude about it.
Well, you're a lot more responsible.
Exactly. Of someone's life.
Right.
And during my time as being a nurse practitioner thus far, I've been diagnosing people with things that people have missed. And saving lives. Some I couldn't, hopefully hoped I could save, but timing was not right. But we always got them in the right place. But some you save, some you can't, based off the timing that you meet that person.
Right.
Yeah.
Well, then again, too, I mean, I always think about this, and as a physician, I even think, we say saving lives, but we're postponing death because the mortality rate is still 100%.
Yeah, that's
and
true.
one of the things we should not just look at quantity, like how long can you live, but quality.
Yeah.
I've got a loved one in hospice right now, and it's, while sad, he's comfortable, right?
Yeah.
And so I've chosen the mentality or the attitude of, I had the luxury of having this very important person in my life in a positive manner for my entire life, and he's not, and he's very comfortable.
He's not suffering.
He's not suffering.
Exactly.
Now, would I want him for longer? Absolutely. But I don't get him the way I had him, right? And so that also makes me think, when we're treating people, we're not just trying to extend their lives, but we're trying to magnify the quality of their life that they have while they're there. And part of that, I think, is that they have a meaningful clinical experience when we're visiting with them.
Yes.
I don't know about you, but a lot of times I'll tell some people something and they go, I didn't want to hear that. And I realize, like, yeah, but you want to hear the truth, but can you hear it empathetically and with a caring heart?
Yeah.
Where it's like, hey, look, I know this is not ideal, but here's what it looks like before you. And oftentimes I think when people find that out, then they can adjust their life accordingly to the truth rather than a hope of something that's really not going to ever happen,
And that's how I live my life. I stand by the Navy Corps values, unencouraging commitment. So I always speak honesty. I don't try to hide or cover up or anything, because people need to know the truth.
That's right.
And if they know the truth, they can make the decisions upon themselves on how they want to move forward. And that's how I practice.
That's right.
Because I feel like that's the only way you can practice. Because if you're not truthful with the patient themselves and covering up and trying to, I guess, what's the word, empathize with their feelings in the same breath, is like you're not helping them.
That's right.
So
I have a number of patients, and if I realize it's going to be difficult to tell them something they need to hear, I'll say, hey, we need to have a difficult conversation. Do you want it straight or sugar-coated? And what does everybody say? Give it to me straight.
Straight, yeah.
Oh, you need to lose 150 pounds. Oh, no one's ever told me that. I've been to 100 doctors. And so it's crazy to me that a lot of doctors or providers won't have the difficult conversations that could be the most impactful thing there is for that patient, right? Is to hear something truthful that they needed to hear that would be a pivot for their life,
Exactly. And I mean, it amazes me that, new patients that I do receive sometimes, they're like, oh, no one ever told me that. No one has to sit down and actually explain this to me. And I'm like, well, you came to the right person.
That's right. So tell us about what you have going on in your new venture.
So my new venture, I do quite a few things in my practice. I do family practice, primary care, chronic disease management, IV hydration therapy. I am also into weight management now to help people, justify their eating habits, nutritional value, and things of that sort. And I do a little body contouring. So I'm always trying to make each and every person the best person they can be.
That's right.
But I always tell them, you got to help me help you too.
Right. Just, you got to make right decisions.
Yes. So those are things we're doing at, my clinic is called Heart to Heart.
Mm-hmm.
We are located at 1984 Wooddale Boulevard.
Now you started in Cortana before Amazon bought you out, right?
Exactly. And I wasn't even there a whole year, I don't think. And I was like, oh my goodness, what I'm going to do? I just got this all together.
Yeah, that's how that works.
And then started riding around the area, just looking for lease spaces. And thank God I found a space that was for lease. And I was like, the amount I'm paying for this lease, I might can purchase a building. So started thinking, looking around again. And I found the building, and the building was off Wooddale. And heavenly sent, thank you, God.
Mm-hmm.
I purchased it during COVID, and I got it for a good price.
Now, did you have to overhaul it and stuff to make it your own?
I did. It was a lot of interior work that needed to be done. The contractor I had, I really thank him, was Floors to You Home Improvement. Mm-hmm. Great contractor, worked with me with the building. Still working with me now. I appreciate him. And still a lot of work to be done, but because it's a big building. But it's very nice. It's very nice. It's still coming along, little by little, but I appreciate having my own.
Well, let me ask this. You've got to be very proud of where all that you've earned in your life story. What would you tell the young lady on the ship at 17?
I never knew you were going to go through this. I never expected your life to go in the lanes that it has gone. Never knew I was going to end up being the person that I am.
What advice would you give her?
That 17-year-old has the same motivation as this 45-year-old sitting here today. She's always been a go-getter.
Nothing will stop you.
And nothing. And, I lost my oldest daughter. Mm-hmm. So I thought that was going to be a break in my life, but I've worked through that, and I'm still going. So, yeah.
Well, what do you say about the fact that everyone's got scars, and scars tell stories?
They do. Thing I say about scars, as long as they're able to heal,
right,
and you keep going, you can make anything, and keep prayer and God in your life.
Amen.
And you can keep going. So scars don't stop nobody. It didn't stop me. It'll never stop me.
Never stop. Well, and that I think is a spirit thing, that it's a will that, there might be a roadblock or something that looks like a dead end. But people that have the spirit that you have, it's like, no, this is just a detour.
It is, exactly.
And I think it's important, it's a mindset thing, right?
Mm-hmm, it is.
Is this a dead end or a detour? And that has to be a mindset that this is only a detour. Because if you tell yourself, if everybody's saying it's a dead end and you tell yourself that, then it is.
Exactly. So you have to be a strong-minded person.
Right.
And if you're that type of person and believe that no one obstacle can stop you,
right,
you can always keep moving. Because I feel like this. My saying, and I have this in my house, God don't put more on you than he thinks you can handle.
100%.
So I say, God, you must know I can handle mountains and roads and everything else, because you
keeps coming.
Yeah, you putting a lot on my back.
Yeah. Well, my mom used to tell me I would go through something difficult, and she'd say, you're building character, and it's going to prepare you for the next thing. And then after several rounds of that, I was like, Mom, I'm tired of building character, because the things keep getting harder.
Exactly.
But that's, I read a quote, something to the effect recently of, I've never met someone who had greatness that did not have challenges. And for us to want, for our children or for other people, a life without challenges is almost going to guarantee you to a life without greatness. Mm-hmm. And especially for those of us in this profession, whether it's the Navy or healthcare, greatness to us, I think, is about giving.
It is.
Can we give health or advice or strength to the people around us, right?
Yep. That's what we do every day as providers.
Right.
We touch lives every day, and we give them hope. We give them some type of guidance on how to go in the right direction and to lead them to the place of success.
Right.
We try to lead them to the place of success, but everybody got to work together.
Well, and you said something earlier, I make sure, and I tell my patients, and let's say somebody comes in, terrible knee, terrible hip, initially they'll say, I never want surgery. And they've been to doctors that say, I had to have surgery. I said, look, you'll never hear me tell you have to. Mm-hmm. Guess what people did for thousands of years that had this? You just live with it. Mm-hmm. But if you live in chronic pain and it gets bad enough, you can get to a place of hopelessness. Now, whether it's physical pain or loss of a loved one, you've had that as well. Mm-hmm. If you find yourself hopeless, that's a terrible place to be. Yes. And so what I tell my patients is, what I'm here to do is to give you a pathway out of hopelessness when you get there, to know that, like, wait a minute, I have an option. And so I'll then kind of convert it with a little bit of humor to say, I will only ever do your hip or knee replacement under two circumstances: if you need it and if you ask nicely. You have to want this.
Yeah.
But there's a pathway where you don't have to be in that much pain.
Exactly.
And I think there are counselors and therapists that do that for emotional,
support. Yeah.
Yeah. We do it for health needs. Now, I happen to also believe that when people have a physical ailment, they have a spiritual vulnerability. Your mortality becomes pretty evident when you have a physical ailment, whether it's your heart, your knees, your hip, mm-hmm. whatever. Nowadays, your mind. And so for us to meet them in that, what I think is a very sacred place, for them to be vulnerable with that. And I think even when people are angry about something, like, you know what, they're hurting, I give them the grace to be angry. Yeah. They didn't expect this. So it's not at me, it's at the situation. Yeah. So let's diffuse that, talk about truth and options, and ultimately give them the power that you get to choose how this goes.
Exactly.
And I'm here to serve and help you. And boy, people just kind of,
Yeah, and then they go home and think about it.
Yes.
They go home and think about it, and they're like, yeah, there's some truth to what they're saying.
Right.
We'll go back and have this conversation.
Right.
Yeah.
Let's ask one last question. Mm-hmm. What's next? What's the next chapter for you?
The next chapter for me, oh, Lord, what could that be? Like you said, make commander.
Yes. What an achievement. I mean, how many people can say, I'm a commander in the United States Navy? I know.
You can.
I can. Thank you. But I mean, that's quite an achievement.
Yeah.
Especially starting at 17, if you just said, okay, one of the things that's going to happen in your life when you're 45, 46 years old, you're going to basically have your own practice as a nurse practitioner, very successful, and you're going to be a commander in the United States Navy.
Yes, great achievements. But, I downplay myself a lot because I'm just doing what God puts in my way and allows me to do and achieve. The hard work and mindset that I have, but I guess I just don't look at it like a great achievement. I mean, I don't.
Well, that's probably the way you should look at it. Yeah. Is the tag that goes on the end of your name or the beginning mm-hmm. does not come anywhere near summarizing the essence of your being.
Exactly.
In a world where most people are chasing a tag, mm-hmm. like how can they get likes or a name or an identifier of some sorts? And it's just refreshing to be around someone who's so talented and great and caring and loving and empathetic and helpful, that has the tags, that doesn't seek them or live on them. And so
that's you too now.
Well, thank you. Well, birds of feather, right?
Yeah, flock together.
Yeah, and so I guess that's why I think we had such a special group in the Navy, is because we were all like that to some degree.
Exactly.
And then if somebody needed something, we're there to help. And one of the things my dad used to always say, there's no limit to the amount of credit. There's no limit to the amount of good a person can do. Yeah, if they don't care who gets the credit.
Exactly.
And I'm seeing that in politics now. It's a whole different war land. But definitely in our circle, healthcare and military, it was whatever it takes to get it done,
We get it done.
Yeah.
Whatever means necessary.
Well, I just thank you for being on. The vibe of this whole thing is, let's just have a conversation that perhaps other people what gift can we give to them? And I think the gift we gave them to you is your story, which has got so many pearls in it. And I'm just so grateful that you'd be on. And
I appreciate you having me here. And I'm out here for anybody that has questions about the military. I've done enlisted side, officer side, managing life. Been a fiance in the military. Had kids in the military, juggling many hats. As women, we do that a lot anyway.
Yes, y'all do it better than we do.
But I'm always here. Anybody want to come and talk to me at any time. Not just about military, about becoming a healthcare professional in my realm. And I do, like right now, we have externs that come in. I am a preceptor for nurse practitioners at my clinic. We collaborate with Delta College to have their students come in and shadow my staff and things of that sort, so they can get hands-on training. We've worked with other local technical schools here as well to, help them evolve into that great person that they want to be.
Well, you've taught me so much because I remember while I was in the Navy, I had 4 bosses, and
you keep saying that.
They're all African-American females.
Yes,
Commander Costin, you. And I did whatever y'all said, and it worked out better that way because y'all knew the answers, and so it was amazing. I learned so much.
Yeah. And we enjoyed you. We miss you.
I know. I miss y'all too.
Yeah.
We'll have to have a reunion sometime together.
Yes.
Well, look, thanks. Where can people find you?
You can find me at, once again, Heart to Heart Care Clinic, 1984 Wooddale Boulevard in Baton Rouge, Louisiana. Can be reached at 225-300-6010.
Social media?
Social media, Instagram, H2HCC, Facebook, Twitter, TikTok.
Nice.
And also LinkedIn.
Good.
And hopefully I'm looking to be a vendor at next year's Super Bowl.
Excellent.
I'm working on that. That's my next project.
Well, there's a great book I'll recommend. It's called The Gap and the Gain.
The Gap and the Gain.
It's the way to think about it is some people might think, well, that's a huge step to get to the Super Bowl, and that's the gap, right? Mm-hmm. But if you look at your entire life, you started on a submarine at 17. And
a subtender
ship.
Yeah. Mm-hmm.
And look at all that you accomplished to get to where you are. And that, if you look, wow, if I did all of that, I can be a vendor at a Super Bowl.
I'm going to make it happen.
I believe you.
I'm going to make it happen.
I believe you.
Kind of way.
Well, look, I hope all our listeners follow you. I love the name of your clinic. It's very reflective of you as a person. And much love. Very proud of you. And thank you for all you do.
And thank you, too. I appreciate it.
Great seeing you.
All right.
Take care. Thank you for joining us today, and a big thank you to all of our listeners for tuning in to this surgical exploration of politics, healthcare, and life. I've been your host, Dr. Craig Green. Remember to stay informed, stay sharp, and join us next time to see which of life's topics we'll dissect under the knife.